Thank you for tuning in to Macroview Television, and welcome to another edition of the Taiwan Outlook, the program that gives you the different faces of Taiwan. I'm your host and program moderator, Wu Ruiguo. Like many places around the world, there are some individuals in Taiwan, particularly young children, who needs professional counseling and play therapy to learn to communicate with others. And on today's program, we're delighted to have Dr. Wen-Hsiu, who's a professor of educational psychology and counseling at the National Hsinchu University of Education, to discuss the theory and the application of play therapy in Taiwan. Welcome to the program, Dr. Wang.
Hi, Dr. Wu. I'm honored to be here.
Well, it's a pleasure to have you here on the program. Yeah. If I may start off with some theoretical questions first.
Okay.
Can you please briefly explain to our audience that what is play therapy? Why do we use play in therapeutic treatment of patients who have problems communicating or making contacts with the outside world?
Okay, according to the Association of Play Therapy, that's the APT, the definition of play therapy is the systematic, I'm sorry, it's a long sentence, so I need to watch.
No problem.
The play therapy is the systematic use of a theoretical model to establish an interpersonal process wherein trained play therapists use the therapeutic powers of play to help clients, that usually the children, to help children to prevent or resolve their psychosocial difficulties and achieve some optimal growth and development. So it means we need to have some trained play therapists that use their theoretical background and the media play to help children.
Okay. Let me ask you, Dr. Wang, some of these problems in terms of communication with others, born naturally, or is it something, they acquire later because of the environment that a particular child grows up in?
Okay, sometimes I think part of them are born with.
Okay.
For example, some ADHD and autism, high functioning autism, those children, Asperger's syndrome, those children, they are born with.
Okay.
But for other people, for other children, they are acquired because of their family atmosphere or whatever happened in the school, the bullying.
Okay, yes.
Most popular.
School bullying.
Yeah.
That's a serious problem in Taiwan today. Yes.
Yeah, so I think part
of combination of both.
Yes.
Okay, but why do we use play in therapy? I mean, what's the value of play in therapeutic treatment?
Okay, I think we all grow up as a child. We all know the joyfulness when we play.
Yes.
When we experience when we play. And if you go to McDonald's or some fast food restaurant, you can see children playing joyfully.
Of course. And
naturally. So that's their task for their life. So play is a very natural medium for children to express their concern, their difficulties, their inner side feeling.
Okay.
So play is a very natural medium for them. And for the play therapy, because children have very limited language, verbal capacity or cognitive ability when they are young. So they need to play to express their dark sides of their feeling and what they have encountered. They cannot express through verbal, but they can play. They can play out when they use those toys and all kinds of medium.
Okay. And so, in other words, maybe we use play as a medium, as a channel, to try to get in touch with the inner feelings of a child, and try to get her or him open up and try to explain, express his or her feelings. And what is the state of play therapy in Taiwan?
The first professional organization of play therapy, that's the Taiwan Association for Play Therapy.
Yes.
Was founded in 2005.
Okay, that's only 6 years ago.
So it's still in its
fairly
infancy.
young.
Yeah, very young.
Okay.
Yeah, so it's about 6 years ago we founded that organization, and so far it's still the only one organization so far. And we have about because I'm currently the president of that association.
Yes.
So I know a little bit about that. And there are almost 300 memberships so far right now. And nearly more than 1/3 of them are professional members.
Okay.
Others are students or non-professionals.
All right.
Yeah.
And if I may ask you, Dr. Wang, what is the population of people in Taiwan, including young children, that have a problem in terms of communicating with others that may need play therapy?
Okay, that's a good question. I'm not quite sure because I don't have any exact...
It's okay. You don't have to give an updated figure. Just roughly, what's the range?
If you are, we are an elementary school teacher, a regular teacher, a classroom teacher, usually they will say that there are, it consists of 30 students per class right now.
Yes.
30 students.
Okay.
And usually teachers will say that they have difficulties dealing with at least 2 to 4 students. They have trouble to dealing with.
Okay.
So those are high-risk students, and I think they are appropriate for our population to do the play therapy.
So if we project that roughly 10% of the population, maybe more so among the younger generation, that could have problems communicating with others, in the sense that play therapy could become an effective means of dealing with those problems of communication.
Yes.
And how often do therapists around the island use play therapy to try to treat their patients?
I think we need to promote more. Okay. Because there are not many trained play therapists in Taiwan so far. Okay. I think roughly maybe in Taipei maybe there are more, but for the whole island, I think at most 100 or 200 play therapists. So they cannot afford. But those are so many population to be helped, but they are not enough. Since there isn't enough qualified or trained or licensed therapists to help those patients. Are there any other schools or organizations in Taiwan besides the Taiwan Association for Play Therapy? Are there others that people can seek counseling or assistance if they have a member of their family that has problems communicating with others? Okay, so there are 2 tracks you are referring to. One is the training part. For the training, there are currently maybe 3 universities for doctoral program. They they train some, they offer some play therapy courses. And maybe around 10 to 15 master programs. They have some courses for some kind of play therapy. So those students, after they graduate, they know something about play therapy. But they still need to take national examination. Not necessarily. Because but how do they qualify to become a therapist? Yeah, so that's our job for our association. Because so far in Taiwan, we only have licensed counseling psychologists. For those certified counseling psychologists, they have to be the master degree. But after they graduate and they get the licensed professional counseling psychologists, they can do play therapy, individual counseling, group counseling or whatever, or family counseling. So play therapy is only one part of it. So that's for the training. But for the hospital or community setting, they don't offer formal training. They provide some in-service workshop or seminar, but not a very consistent and very systematic training. So that's for the training. How about schools? Do we have many schools at different for people of different ages? They can attend just to help them with the communication problems. So you mean for the elementary school? Or elementary school, or junior high, or secondary. We have counseling office, or counseling. Office of Counseling, whatever. So for the elementary school counseling center or counseling office, some schools, they offer play therapy. If their teachers, they can they can do some therapy, but most no.
No, they're not qualified.
But for the junior or secondary, we don't usually use play therapy because it's appropriate for age from 3 to 12. So for the adolescents, we have another kind of activity to help them.
Another related question is regarding the difference between play therapy and sand-play therapy. Can you explain for us?
Okay, there are some similarities.
Okay.
Because they both use medium.
Okay.
For the sand tray, they use some miniature.
All right.
Objects, we call that.
All right.
But for the play therapy, there are more diverse categories of toys we can play, but they are all medium for people to help them to express.
Okay.
But they have different theoretical backgrounds.
All right.
Behind.
All right. And do you have any plans to do any cooperation or collaborative work with the Taiwan Association for Sand-Play Therapy?
Yeah, I think many play therapists in our association, they are also the member of Sand-Play Association.
All right.
And they know both ways to help people.
Okay.
And for the Sand-Play therapy, the population they help can across the whole age span.
Okay.
So for the old people, they are used to, they enjoy themselves in the same play, but not in play therapy.
Okay, good. All right. As we enter the year of 2011, there are a lot of people in Taiwan under a lot of stress and pressure. And sometimes the issue of communication problems does become a concern for many families and individuals. We're delighted that on today's program, we're able to have Dr. Wang to explain the practice and the theory of play therapy with us. And we're going to take a short break. And when we come back, we'll continue this very fascinating conversation with Dr. Wen-Hsiu, who is a professor of educational psychology and counseling at the National Hsinchu University of Education. I'll see you in just a few minutes. Welcome back to the second segment of today's program here on the Taiwan Outlook. I'm your host, Wu Guo. We will continue this fascinating conversation with Dr. Wen-Hsiu, who is a professor of educational psychology and counseling at the National Hsinchu University of Education. Dr. Wang, we have talked about the importance and the value of play therapy in treating people with communication problems. Let me ask you a question. In terms of practice, how do you know if somebody, irrespective of his age, that needs, counseling, needs professional help, and maybe needs, play therapy?
I think there are two parts. From the parents' part, if they experience some difficulties when they are raising their children. For example, their children have some nightmare, or they have some behavior problem, and eating disorder, and those kind of behavior they have trouble to deal with. So they will refer their kids to the play therapist or school counselors. And for the teachers' part, when they are in the school and they can see very clearly how their students behave all day long. So maybe they have some difficulties also when their students are confronting with some behavior problem. They try to they are too aggressive and they are too shy, and so they can refer their students to our play therapist. Otherwise, there's some natural disaster for the earthquake,
trauma,
some trauma, And for some children, they lost their parents. Their parents are experiencing some divorce or some stressful issues, and maybe some students, some children, they have been sexually abused, and they witness domestic violence. Those children, they are eligible for play therapy.
And if suppose I were a parent and I discover some of the traits that you're just explained in my child, and as a parent, of course, the first reaction may be one of shock, one of disbelief. How could this happen to my child? And what would be the counseling advice that you will offer to parents of these children?
First of all, we would do some intake or some assessment. To meet with parents first, and to see their problem and how they suffer from the discipline behavior or whatever. And so we would talk a lot about their discipline with their children, how they have done to help those children, and what are good for those behavior they have done, and but what were not successful. So we will try to discuss with parents first, and to see their observation and about their children, and we'll also encourage the parents. I think they are quite discouraged, so they are so disappointed. So we will try to encourage their parenthood in the beginning, and we will try to ask what their concerns are and what their major purpose for referring their children to us. So we'll try to do some homework beforehand.
And as I bring my child to a therapist, and when does play therapy comes in the treatment of the child?
Before we initiate our first session, we will ask our parents to introduce the play therapy setting and the play therapist to their child. So there is a book. I didn't bring that book with me today. That's an introduction of play therapy. So we will ask parents to read those books to children, so they won't feel intimidated when they come to this change setting. So we will ask parents to introduce in the beginning, and we ask the parents to bring their children to us, and we will show the children the play therapy setting, and try to be friendly as possible as we can. So the children, the child will be here, and maybe in the beginning they will be shy, and they will try to test our limits. But gradually they will become familiar with the setting.
Once they become familiar with the setting, it becomes really interaction between the therapist and the client, the patient. And what is the role of the therapist in the treatment of the child?
I think it depends on the theoretical background of play therapist. Some, for example, my theory base is child center. So in this way, I will try to be the facilitator, and when I'm working with the child. But for some more structured therapist, they will be a leader, instructor. They will teach students how to cope with their life difficulties. So it depends on the theoretical background of the play therapist.
And the fact of the matter remains is that once the child is discovered with a communication problem, then what's the percentage, what's the proportion of people with communication problems that actually be given play therapy as part of their treatment?
I don't know the exact number, but I think it's far less than we expect.
So it's not automatic.
No.
Other than play therapy, what would be some of the other techniques used by a therapist when a child comes to you and saying that the mom and dad may say that my child has a problem communicating, or has eating disorder, or dealing with schoolwork and things? What would be some of the first things that, as a trained therapist, that you would recommend at the beginning?
You mean besides the play therapy?
Besides that.
I think we would do some family or family play therapy. Consultation with parents first. We want to empower parents to be a good parents even without our help. But if we want to intervene more, I think play therapy will be the most valuable way for young children. But besides that, a small group counseling that would be helpful too. And some classroom guidance course that would be helpful. That's a more primary preventional way to prevent those children to become more serious.
So play therapy is actually sort of like a last resort.
Yeah.
It's not something that happens at the very beginning of the treatment.
Yeah, but besides play therapy, there's another way we call filial play therapy.
Okay.
Filial means parents.
Oh, okay.
So we train parents and they go back home to do some play therapy with their children.
Okay.
So it doesn't mean that their children have to be very severe in the sense. They just want to enhance the real relationship between each other. So that will help them too.
Okay. So Dr. Wang, how important is it for other family members to get involved in play therapy?
I think it's very important, especially for those young children, because they rely too much on their family to support them financially, physically, and psychologically.
Okay.
So as long as the family member can support them, I think their problem can be less and less.
All right.
Yeah.
Also, would you think that if, for example, the parents are involved in the process, as you said, they may go home with the child and then play with them, and try to be, like a trained therapist, and use, play therapy with the child, and try to ease that transition. Instead of a child confronting a total stranger, the therapist, they can try to use similar techniques with the child first and try to ease that transition. Would that be helpful?
Yeah, that would be helpful. According to a lot of meta-analytical research, the most effective will be the filial therapy. That means parents help their children. They will be most valuable and most helpful. And the second will be the trained play therapist. And following will be the trained paraprofessional. For example, school teachers, if they are trained, they might be helpful too. Okay,
good. And how long does normally the play therapy session will last? Like 6 weeks or 3 months, or how long?
Usually we have a session on a weekly basis. Basis.
Each session is about what, 2 hours?
No, it's too
not
long.
Not that long. Okay.
Children cannot last that long. They cannot concentrate that long.
Okay.
So maybe around 30 to 40, at the most 50.
Minutes.
Or 60 minutes.
Okay.
So 60 to 1 hour.
All right.
That's per session.
All right.
And on a weekly basis.
All right.
And usually from our research shows that average 20 sessions will be most effective. But in the school setting, we don't have that luxury time, because whole semester, I think at most 15 sessions will be helpful too.
So anywhere from about 3 to 4 months and all the way up to 5 months.
Yeah,
maybe the period that you were, sit down and with the parents and possibly with the child to evaluate whether the play session, play therapy has actually worked.
Yes.
How would you evaluate that? What are some of the criteria that you would use? I
think it's also based on the theory of the play therapist. For the more cognitive and behavior therapist, they have some checklist to see the behavior of the children increase or decrease or maintain. So that's a checklist.
Right.
But for the other theories, maybe they will say that in a more vague term, they say children are happier right now and they drop school less.
Okay.
And they have less nightmares. Yes, and they eat more, they smile more. So that's another way to evaluate.
Good.
But I think the spirit of the play therapy was the relationship between play therapists and children, the child, the client.
Right.
So the relationship, if the child can feel that he or she is secure enough to be real him or her. And the relationship, it helps a lot. So for this kind of children, when they go back home, they have better relationship with the parents and schoolmates and peers and teachers.
Siblings.
Yeah, I think that will be another indicator.
Yes.
Indicator.
Okay. Good. Yeah, I want to thank Dr. Wang for giving us that, very practical aspects of play therapy in Taiwan. And when we come back, Dr. Wang has brought with her, many of the toys and other things that are used in play therapy sessions. We're going to get a first-hand look as to how these toys are used to help a child in terms of, overcoming their communication problems. We'll see you in about a few minutes. Welcome back to today's program here on the Taiwan Outlook. I'm your host, Rui Guo, where we'll continue this very interesting and fascinating conversation with Dr. Wang Wen-Hsiu, who is a professor of educational psychology and counseling at the National Hsinchu University of Education. Dr. Wang, I can see that you brought a table full of toys, for us today. Can you then share with us, based on their sizes, their purpose, what are these toys for in terms of play therapy?
Usually we separate, we categorize toys when we do some play therapy.
Yes.
And for example, those are, no.
Yeah, we can try to dialogue through this. I'm not very good with this Muppets, but we can try.
Okay. Hi,
yes.
Nice to see you.
Nice seeing you too. Yes, yeah. It's not a very nice day out there, but we can go out and play sometimes.
Oh, okay. I'm glad to.
Okay.
See you.
All right, see you.
Okay, so that's for the conversation purpose.
Okay.
If some children they are too shy or they have some secret.
Okay.
They are so hesitant to tell from their mouths, but they use this puppet, they can express their real concern. For example, they will say that he or he is suffering from his parents are divorcing.
Okay.
So he's poor or he has been cheated. He's been bullied by his classmates.
Okay.
He's poor, so he won't say himself, but he'll point to that puppet.
Okay.
So that's for this purpose. And
good.
For those knife or swords, gun,
yes.
They are aggressive. So for children,
okay.
They have some tendency to play out their anger or their hate to someone they care about. So they would do some fighting there.
Okay.
And also they can show their power when they are playing those sword or guns or whatever.
Okay.
And they will try to test the limit between themselves and play therapists. They will shout at you and to see what you would respond.
Yeah. Okay.
So that's for the aggressive part.
Okay.
And those are animals either on fly or on the floor or what?
On the ground?
On the ground, yeah.
Yes.
So those are
lizard, spider,
yes,
alligator, and then rattlesnake, and dinosaur, of course.
Yeah, so they can, those animals, they are fierce and they are violent, but sometimes they are very mild. And we would prepare for the family for this, for example, the zebra. We have
zebra father,
mother, and the whole family.
Okay.
So if it's too threatening for them to have real people here, they will have family like this.
Okay.
They resemble their family.
Okay.
So those they have some symbolic meaning.
Of course.
Yeah, they would say that if I have some devil in my heart, and I would try to play this, and if I want to try to against some violent part of some force, I would say that I will bite you. Whenever I say that I can bite this one, and I see I'm more powerful when I do this.
Okay.
So those are animals, and those are real life. I think we all like that.
Coin, money, yes.
Yeah, cash. Yeah. So those children, they can play.
Is that purely for the sound when they mingle with them?
No, I think it depends on how they play.
Okay.
So they can just play. And they will say that my parents, they are poor, and I know they are concerned about their financial status.
Okay.
So I hope I would be rich enough. So I pretend that I'm a prince or I'm a king and I have a lot of money, so that will please them a lot.
Okay.
And those transportation, we have airplane and cars and ambulance and fire truck, whatever. So police car, those are very symbolic because some children, their parents are prisoned. They got caught by the police. They would play that scenario in the play therapy setting.
Right.
And those are the real life, those are for the nursery part, because when children begin to play this, they're just playing real life scenario, but also they can nourish themselves. If sometimes they can feed themselves or feed the doll.
Okay.
And those are family figures, and we can see how
brother, sister,
grandparents and parents. We can see how they project their family members in this way. And these are expressive crayon and color pencil.
Pens, yes.
Yeah, and those papers.
Paper for them to draw on.
Yes.
Yes.
So those are expressive and domestic and real life and aggressive, and those are the categories for play therapy to prepare.
All right. But Dr. Wang, as a parent of a young child at home, I mean, these toys are very ordinary in the sense that any normal child could play with it.
Yes.
But as a therapist, how do you know if this toy will be useful in your therapy with the child?
I think according to our experience, and we think they are therapeutic because they can be real. They can represent their real life scenario, but they can also symbolic. So we need to learn how to interpret the inner meaning of how they play and what they are playing, how they play out their real concern.
All right. All right. After discussing on these toys, let's talk about play therapy room.
Okay.
And I know that is a very specially designed room for the therapist and the client.
Yes.
And what are some of the major differences or some of the prerequisites or conditions that are needed for a play therapy room to be useful and successful?
For some play therapists, if they cannot afford to have a regular room, they would just have a bag with them, and they can go around and to sit, just to set up a corner and to put display of this. They will do okay. Because what is more crucial is the relationship between play therapist and child, not the toys.
Okay.
Yeah, but if we have some, we can afford to have a regular room.
Okay.
The security. And privacy, a secure environment. So the setting should be maybe, I don't know the size. But usually the open shell will be needed because those are displayed openly, so children can take whatever they want to play
and
the
what
way.
they see is what's actually available.
Yes.
So there isn't any thing that will pop out of the closet.
Scare them, no.
Yes. And so basically, I think two elements that you mentioned are very important. One is privacy, and second is a secure environment.
So the furniture should be strong enough. They cannot be hit by the table or what. And also, it will be better if we have some soundproof and waterproof, because they would need some watercolor, so they will destroy the carpet. So that will be washable, all the furniture.
All right. As you know, Dr. Wang, we're entering into the electronic age. There are many online games available. Will online games also be helpful in terms of play therapy? You don't think so? Why?
Because when children are playing on the online game, they just focus on that game.
On the game.
They don't have any interaction between themselves and the play therapist.
But wouldn't you think, for example, if a child is very good at a particular online game, that will give him or her a sense of confidence? Hey, I'm very good with this. Maybe I'm not good, communicating with people in school, but I can do this online game very well. So, wouldn't you think that that would be a plus?
That's a part of story, another part of story, because they have got the sense of achievement, and I'm not sure about that. But besides that, they don't have any opportunity to communicate with real people. So that's the concern.
So the secret or the very important element behind play therapy is interaction. Whether it's interaction with parents, with a therapist, or with therapists, it needs to have interaction with the people.
And qualified.
Qualified. therapist.
Good quality,
Okay.
yeah.
All right. And let me ask you that, Dr. Wang, after being the play therapy session for a while, and then you will want to assess
Yes.
how the child has progressed, and also in the context of the overall development of a child.
Yes.
And if it's positive, will the therapy continue, or will you try something else?
I think you are referring to the termination.
Yes.
When to terminate?
Yeah, when do you think the play therapy has done its course, that we should do something else instead?
Yeah, I think it depends on the progress of the child.
Okay.
If, for example, if the child, we know that he or she is afraid of some snake or some, but in the long run, he can play with this or very freely. I think he has overcome some fear about that animal.
Okay.
And for example, if he or she has some concern about the interaction, the relationship with the other people, but in the playroom, they can become familiar with the play therapist, and they can show their real fear and their real pride, real feelings. I think that's an indicator.
Yes. Yeah, and that's also a very significant progress for the child. Yes, we're going to take the final break on our program today, and when we come back, we're going to ask Dr. Wen-Hsiu about some of her actual experiences in play therapy and in treating some of the children with communication problems. I'll see you in a few minutes. Welcome back to the final part of today's program here on the Taiwan Outlook. I'm your host, Ray Guo. We'll wrap up with this very interesting and fascinating conversation with Dr. Wen-Hsiu, who is a professor of educational psychology and counseling at the National Hsinchu University of Education. Dr. Wang, can you share with us some of the memorable cases that you have treated in terms of using the play therapy method?
So far, actually, I'm going to my play therapy session this afternoon when I go back to Hsinchu.
Yes.
And currently, I have several kids I'm working with.
Okay.
And most of them, they come from neglect families. Their parents don't look after them very carefully. So, and some kids, they have been abused severely by their parents, and some are sexually abused by some stranger or domestic. So those are my clients.
Okay.
And during the play therapy session, I try to have more good relationship with them and try to let them feel that this environment is secure enough for them to express their real feeling.
Okay. And
try to overcome their fear and try to express their anger toward those people they hate.
Okay.
So that's my work.
Okay. And as I stated at the very beginning of our program today, that certainly this is not a problem for Taiwan only. No. Many places around the world also have this problem, especially among the younger generation of children. And the fact of the matter remains is Taiwan is probably one of the more emerging places that are dealing with this issue of communication problems with the younger children, in a very systematic and therapeutic, way.
Yes.
And how about the regional and international cooperation that you have, as president of the Taiwan Association for Play Therapy? That you have been involved with. What are some of the likely prospects that maybe in the future, not only they're doing it on the international and regional level, but also with China across the strait? Okay,
that's a very broad question.
Yes, very big. Yes.
So far as I know, the play therapy in mainland China is still in its infancy.
All right.
They don't have a lot so far, but I think children in mainland China, they need more play therapy.
That's right. Yeah, because they have the one-child policy,
Yeah.
so
Yeah.
the child becomes the focus of all the families
Yes.
in China.
Yeah.
So a lot of times they may have problems because they get too much attention.
Yes.
Okay.
So the children there, maybe they have less tolerance of frustration than the children here.
Okay. All right.
And because they are a single child, so they don't have much opportunity to interact with other peers.
Yes.
That will come out another problem.
All right.
So I think I hope we can have some cooperation with mainland China, some agencies there.
Okay.
And for other international, I know Hong Kong, for example, New Zealand, and UK and United States, they are very well established organization about play therapy. And actually, I have some communication via email, right, recently with the APT, the president.
Okay.
We are talking about some cooperation between, and we want to develop some ethics code of this play therapy in Taiwan. And also we want to have some certified program for the play therapists. So I'm trying to communicate with the president there, of APT.
Okay.
We try to promote our professionalism.
Okay. Is APT an international organization?
Yeah. Actually, it should be a national in the United States,
only,
but it's globally recognized as the leader in this field.
Do you have maybe an annual conference where all the countries participate in?
Yes.
And does Taiwan send a delegation every year?
I think not for the whole organization, but for
my individually.
Yeah, individual. For example, I'm also the member of that association.
Okay, and then in the future, that you do think that organization will grow even bigger, and then let people pay more attention and be aware of this problem.
Yeah, maybe as a regional. Specific.
Chapter or something. All right. But let me ask you, Dr. Wang, you being in this field almost 20 years, and the fact of the matter remains is that you can't do this on the donation basis only.
Yes.
There must be something that both the private sector and our government can do. Try to do more in terms of funding, in terms of manpower, in terms of a long-term policy, in dealing with this problem. Do you think that there are recommendations that maybe you can make to our government and the private sector? Corporations, for example, that they can offer their assistance in what you're doing and what your organization is doing.
Yeah, I think that would be very helpful if the government or some private practice sectors, if they can offer some financial or manpower assistance. In the long run, I think that would be more beneficial if we can have those resources to come in. Yeah.
And currently, of course, your organization, as we were discussing before the taping started, basically you have no permanent staff, and everybody's on part-time, also volunteer basis. And the fact of the matter remains is that you collect just membership fees, and also occasionally when you do a special project, that you may petition for a particular grant or some funding from government or from corporations. So that's how you make the whole organization running for the past 6 years. Any plans in the future to try to expand, because you have over 300 members in just 6 years? That's quite impressive. How about some of the activities that you have already planned for the coming months or coming year?
Actually, we need to discuss with the board members.
But
in my head, I think there are two parts we can work on. The first part, we can cooperate, ask the cooperation of the Ministry of Education. We can train more play therapists in the elementary school settings. And for the social welfare part, I think we can cooperate with the child welfare department of the Ministry of Interior. I think we can also provide more play therapists for people in need to cooperate with them. We try to initiate with that.
Okay. And Dr. Wang, based on your experiences, what are some of the strengths, the advantages that Taiwan has in terms of the development of play therapy?
Oh, that's a good question. I think because many children, they are in need in this rapid changing society.
Yes.
So there is a lot of need for the play therapist.
Okay.
And for my students that I have some training, and I think they are also interested in this area. So I think there is a good market for those two people to get together.
All right.
And I think more and more elementary school teachers, they really don't know how to deal with their students.
No.
If we can provide more training for them, they can be more capable when they are doing some classroom management with children. So I think this is a promising future, but we need more manpower and financial support to do this.
Yes. And Dr. Wang, you being a professor of educational psychology and counseling for almost 20 years, and over the years you have seen the problem becoming more formidable in Taiwan. Of course, as you stated just now, that we need more trained therapists. Do you think that among the younger generation of students, there's also increasing interest to take part in this very meaningful professional endeavor?
You mean undergraduate?
Or undergraduate and graduate?
Yeah, I think undergraduate, they are, I think they are capable, and if they are interested, we can offer more training for them. Yes.
Yeah. But is that part of their, general interest? For example, to study child psychology, to try to be part of this therapist, profession, try to offer their help and professional guidance for children of the future.
Yeah, I think that would be very helpful if we can promote this.
Okay.
Yeah.
And then
more people will be interested in this.
Okay. And finally, for for our program today, Dr. Wang, you are both a professional and also a parent.
Yes.
Can you then tell all the parents who are watching our program today, what are some of the things that you would recommend, you would suggest to them, in terms of bringing their child, their children, up, in the process? What are some of the things that they should be looking for if there is, potentially a communication problem?
I think from the beginning, the parents should love each other.
Okay, good.
Because they can establish a good foundation when they raise their children, and parents need to have faith in their children.
Okay, all right.
And they need to look at the bright side of children, not only criticize them.
All right.
Yeah, and they need to have more confidence in their children and themselves.
Okay.
And they try to discover their strengths, not only their weakness.
Okay, good.
Yeah.
All right. It's been certainly fascinating talking with you today on the program, Professor Wang. I certainly want to wish you and your family all the success in the year of the Golden Rabbit. Okay. Thank you very much for being on the program.
My pleasure. Thank you.
Thank you for watching our program today. I'll see you next time on MacroView Television. Thank you.